Hi, I'm Kristen Buttermore, and I am a licensed mental health counselor, and I am here to talk to you today about EMDR for kids. So just kind of a recap, EMDR stands for eye movement, desensitization, and reprocessing. So basically what that's doing is trying to get the logical side of your brain and the emotional side of your brain to get equal time so that they can talk to each other and kind of process through something or agree on how to define a situation. So a lot of time with little kiddos, they might go through something and their emotion side kind of kicks in, and in that their nervous system has kicked in and it is supplying their body with all the information it needs to either fight, flight, or freeze. So the system can be activated even when we don't want it to. So even weeks, days, months, years later, if something similar feels the same, then that system can start to be activated again. So this is where EMDR can be helpful because it can put that incident or that memory away in a place that isn't so activating for kids. And this works for adults too, but today I just wanted to talk a little bit more about with kids. So kids who have experienced something traumatic, so let's just say that they were in a car accident and it was minor, but the police or the ambulance came to check one of the parents out. So this kid might feel that same sense of fear every time they get in a car, even if it's safe, even if they're not going anywhere, maybe even just seeing a car. So with EMDR, what we would do is we would walk them through this and let them really think about this situation that happened and really feel all the feels, but giving their brain the time to talk with the feels so that they can put it away and they can remind themselves, oh, this is probably not going to happen again, or this might be okay. So the way we do that is we use bilateral stimulation, which sounds kind of crazy, but really it's just anything that gets both sides of your brain kind of moving. So here are some of my tools that I use for bilateral stimulation with kids. The first one is the makeup brush. So for kids, sometimes we have them set their hands on their laps, which you can't really see, but so if their hands were on their laps, I might take this and alternate kind of tapping or brushing their hands. So that would give them that bilateral stimulation. Every time it went back and forth, that would cause their brain to light up on each side. Another thing that I use for kiddos is the buzzies. So these are just two little things that they can hold in their hand or they can sit on them. For really little kiddos, we can put them in their socks. But they just vibrate, alternating back and forth. So like buzz, 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 buzz. And that can be really helpful to get both sides going. It's pretty easy, non-intrusive way. Other things that we might do are little finger puppets. So I might have a little finger puppet, maybe, that I would have them, I can use it on my finger, or maybe I'd put it on a magic wand and have them follow it with their eyes. And so when I start this, what I would do with little kiddos is I might ask them, so think about that car accident. So we'll just keep using that example. Think about the car accident. And then I might say something like, how I'm missing some pieces of EMDR right here where we talk about like beliefs and that type of stuff. But basically I would kind of ask them, get some baseline information as far as like where they're at right now when they think about this car accident. And then I might, let's just say that I do this little finger puppet. I might have them follow it. I might say, okay, think about that car accident. And then I'll have them follow my little panda bear here. I might even give him a name, like he's a helper. So I would do that for about 20 seconds, and then I would ask them, what do you notice? And they might tell me that they notice that their tummy doesn't feel as sore or doesn't feel as flip-floppy. They might tell me that they are thinking a little bit differently about this car accident, they might say something like, well, it was kind of scary, but mom was okay, or something along those lines. And we would just keep doing that. I would say, okay, well, let's just start with that thought. And then we'd kind of go along with it. Another thing that sometimes I do with kiddos is have them, we'll just kind of do this, or have maybe the buzzies going, and I'll ask them, we'll kind of retell the story, and we'll say, yeah, there was a car accident and it was kind of scary, but there are lots of really good helpers that come out and they help people. And they helped you. What were some of the things that they did to help you? They made sure that your mom was okay, or they made sure another grown-up, a family member, came and got you. So that we would kind of re-script that so that that child can pull on the things that are true to that child's life no matter what. So we know that there were helpers there, and that there are helpers in life. So that's kind of an overview. Another one that I almost forgot about, one of my favorites, it's called Scribble It Out. So this is where you would have kids draw out what it was that comes to their mind when they think about that. So I might show you my amazing drawing skills here. And so they might say something like this. That's a car, by the way. And then I would have them scribble it out. So they would scribble and scribble and scribble and scribble and scribble and scribble till you can't see it anymore. What that's doing is giving both sides of their brain time to communicate with each other. So then after that, I would ask more questions and I would have them draw it out again. But those are all some of the interventions that we used for kids, for EMDR, because they can access memories and things differently. And kids generally can go through this process pretty quickly, and it can be pretty helpful for them. Other things I might do are have them hold like a stuffed animal and pet it. We might put buzzies, these little buzzies, might put them in this little hand puppet and just hold the puppet. There's all kinds of things that can be done with kids. So if you have a kiddo that has some trauma or has had a big event or a life transition, EMDR might be an effective tool to use. What I recommend as far as finding an EMDR therapist is to go through EMDR International. So their website is EMDRIA, EMDRIA, and that will give you a directory of individuals who have been basic trained in EMDR. You might find some individuals who have more intense training or more involved training, so they might be have specialties in different areas. There are some EMDR therapists who have gone through a more training so that they can teach other EMDR therapists and provide consultation. So there's a wide variety, but I would recommend that you find somebody who is at least basic trained in EMDR. So that's what I am. I don't have any of the extra credentials, but these are just some things that I use in my office and in my practice for kids. And if you have more questions, check out our Facebook, check out our website at cultivatewellnessames.com and let me know if you have any other questions. Thanks.